Rabies remains 100% preventable yet neglected diseases that continues to claim thousands of lives each year. Achieving elimination by 2030 demands a united One Health approach that integrates human, animal, and environmental health systems. Collaboration across veterinary services, public health, community engagement, and policy framework is essential to scale up vaccination, strengthen surveillance, and promote awareness. Today's panel, Strengthening One Health Action for Rabies Elimination by 2030, organized by Voice of Healthcare and supported by BSV Mankind, reflects our shared commitment to turn aspiration into action. Together, with evidence based strategies and collective responsibilities, we can end human deaths from dog mediated rabies and make zero by 30 a reality. I am delighted to introduce our panelists for today's session. Dr. Simmi Tiwari, Joint Director and Head, Center for One Health, NCDC. Welcome, Dr. Simmi. Dr. Amlan Goswami, Convener, Editorial Board, APCRI. Welcome, Dr. Amlan. Dr. Murugan Appupillai, India Director of Education, Mission Rabies, Worldwide Veterinary Services. Welcome,
Hello,
Dr.
good evening.
Good evening.
Good evening.
Apoorva, Executive Director, Animal Law and Policy Network. Welcome.
Thank you, ma'am. Thank you so much.
Dr. Hemant Gohil, Secretary General, APCRI. He will be joining us in a short while. And Mr. Rajeev Arora, Cluster Head, Critical Care, Hematology and Emergency Medicine, BSV Mankind. Welcome, Mr. Rajeev.
Thank you and good evening to everybody. Pleasure connecting.
So before we begin the deeper discussion, it's my privilege to invite Dr. Simmi Tiwari, a distinguished leader in the field of One Health, to share her perspective. With rabies continuing to pose a significant burden in India, the challenges of awareness, vaccinations, surveillance, and cross-sectoral coordination remains always pressing. We look forward to your insights on the roadmap towards achieving zero rabies by 2030, which will help set the direction for today's dialogue. Over to you, Dr. Simmi. Dr. Simmi, are you there? I think there is some network issue. Dr. Simmi. Right. So I think I'll start with then questions and answers. She can share her perspective later on. Let's start from the clinical understanding that what happens when there is a dog bite and also in the post-exposure management. So my first question is to Dr. Hemant. What are the biggest challenges which is there clinically in ensuring timely administration of post-exposure prophylaxis across India? Dr. Simmi, she's trying to reconnect. Yes, I have Dr. Simmi with me. Are you able to hear me, Dr. Simmi? Can you unmute yourself? All
I'm
right.
able to hear.
Okay. So, ma'am, could you share your perspective how we can end rabies by 2030 and what's the roadmap like?
Thank you very much. And on this August gathering, first of all, I would like to congratulate Voice of Health along with BSV to organize this wonderful session. session on this important day wherein we observe every year the World Rabies Day on the death anniversary of Sir Louis Pasteur, the inventor of the rabies vaccine. So we all know that rabies remains a critical public health challenge despite decades of progress India still bears the highest burden globally and contributes nearly 36% of rabies related deaths. Yet, this day is not only a reminder of the challenges before us, but also an opportunity to observe the milestones achieved so far and to renew our collective resolve. We understand that rabies control program, which has been initiated way back in the 11th year plan with the initiation of pilot program in 5 cities of the country, and now it has been expanded all over the country. It has strengthened the post-exposure prophylaxis availability, many other things like improvement of the surveillance, recording, and reporting of the rabies cases and the animal bite cases, and importantly foster an intersectoral and one health approach in true sense. Encouragingly, suspected rabies deaths has not risen proportionately to the sharp increase in reported animal bite cases. So that is a little bit contrast which we are observing, but at the same time, it is also highlighting that post-exposure prophylaxis coverage and access to the life-saving treatment is now improving, and these are the achievements on the front of national government's worth acknowledging. At the same time, we must confront an evolving reality of animal bites, particularly dog bites, which are emerging as a broader and complex public health issues now. And I think that there is now a shift which is required in a term of paradigm shift, wherein we should actually looking into limiting the dog bite incidences, uh, along with focusing on prevention of rabies death. Uh, Data from the integrated health information platform that highlights an alarming increase in dog bite cases, which has risen from 21.8 lakh in 2022 to 37.1 lakh in 2024, with over 12 lakh cases reported in the first 4 months of 2025 alone. So that is the thing wherein we need to actually focus. The very strategy which has been addressed by World Organization of Animal Health, that we are only required to vaccinate the dog, contrastingly the National Action Plan for Dog Mediated Rabies Elimination give an equal focus on sterilization of dog population, means dog population management through animal birth control, so that we can actually halt the ongoing transmission among this canine species, we understand that behind every number of dog death due to dog bite or eventually due to rabies is a story of pain, vulnerability, and loss. Children, especially who represent nearly 40% of dog bite victims, are often attacked on face and neck. And which is leading to serious injuries and lifelong trauma, including mental trauma. Elderly individuals, especially with the persons suffering from disabilities, they suffering from disabilities, they eventually suffer deeper wounds and slower recoveries because of their age effect. Women, due to their roles in managing household tasks outdoors, they are disproportionately at risk. Yet often have the least access to the timely care due to many social cultural barriers which are prevalent in our country. So the rising incidence of animal bite has also become a matter of social concern, reflecting increasing media coverage and even the legal disputes at times. So these developments remind us that the rabies elimination cannot be pursued in isolation, and a truly effective response must address the drivers of animal bites, uncontrolled dog population, poor urban waste management, and gaps in public awareness. As we mark this important day of World Rabies Day today, it is time to reaffirm collectively our commitment to achieve the global target of 0 by 30 goal. And I would highlight a few points that to succeed, what we should do. Number one, I would again emphasize to strengthen the animal birth control measures with adequate coverage and monitoring. We also need to focus on improved urban planning and waste management to reduce stray dog populations, invest in bite prevention education, particularly among school children, and also among other high risk population. At the same time, we also need to promote management.
Yeah.
Along with this, an equal partnership of the community is very critical, especially our animal welfare organization and other local leaders, housing societies, and also the community dog feeders. They must be seen as a partner in managing stray dog population and promoting the public. Entire August gathering here that the Center for One Health at National Center for Disease Control, Ministry of Health and Family Welfare is strongly committed to foster this integrated approach. We are taking many initiatives. Even I would like to apprise that tomorrow we are observing this World Rabies Day in a big way, wherein other international partners are joining with us in a webinar. Bangladesh, Dhaka, we have invited Ghana, Vietnam, Philippines. So they will be sharing their success stories and how we can move from the other countries in their rabies control efforts. Uh, we are committed for rabies elimination goal, and we are trying to bring together all the diverse sectors and stakeholders to reduce the burden of rabies and animal birth control efforts.
So, with that, I thank Dr. Simmi for giving us insight into what can be done to eliminate, rabies by 2030. And I think Dr. Hemant has also joined because I was
Yeah, yeah,
just
yeah.
shooting.
Yeah.
All
Uh,
right. I was addressing you, sir, earlier, and I was just shooting my first question for the panel discussion. Welcome, sir, first of all. And we definitely would like to hear from you that how timely administration of post exposure prophylaxis across India after dog bite can be achieved efficiently, and because I feel that's the biggest challenge.
Uh, Hi, everybody. The timely administration of post-exposure prophylaxis remains the cornerstone of rabies prevention in India. Yet several clinical challenges persist. First, delayed healthcare seeking. Many bite victims either neglect wounds, rely on traditional healer, or present late to medical facilities, losing critical time. Limited awareness, both public and sometimes even frontline health worker lack adequate knowledge about the urgency of post-exposure prophylaxis, wound washing, and correct vaccination schedule. Stock out, uneven distribution, and the high cost of rabies immunoglobulin continue to affect access, especially in rural and remote areas. Inadequate numbers of designated anti-rabies clinic, shortage of trained staff, and overcrowding in government facility delay timely initiation of post-exposure prophylaxis. Maintaining vaccine potency required robust cold chain system, which may not be reliable in peripheral centers. Follow-up compliances. Many patients fail to complete the full post-exposure prophylaxis schedule due to lack of awareness, travel cost, or multiple hospital visits. High burden of animal bites, the sheer number of dog bite cases in India, strain available resources leading to compromise service delivery. On World Rabies Day, it is vital to address these challenges through strengthening supply of chain of vaccine and rabies immunoglobulin, training health worker, expanding anti-rabies clinic, community awareness campaign, promoting one health approach for dog vaccination and bite prevention. Thank you, ma'am.
Right. So one health approach is what is required. So both, I think, the animal vaccination and human vaccination, that is what is needed, and just to prevent the rabies from spreading and give the timely action, especially for the post-exposure prophylaxis in humans. So, Dr. Amlan, how is rabies immunoglobulin currently used in dog bite management, and what are the main gaps and challenges in its timely administration?
Rabies immunoglobulin is used in category 3 exposures, that is, injuries which bled. Anywhere following a dog bite, it might be very small, but it has bled, that is category 3. And if the person has not received full course of anti-rabies vaccine for a previous exposure before, then that particular person will require rabies immunoglobulin infiltration in and around the wounds. And rabies immunoglobulin is available in two types. One is the equine source, which is more readily available and affordable, and the other is the human rabies immunoglobulin, which is quite expensive and not available everywhere. Besides this, rabies monoclonal antibodies have also entered the market. But the thing is, the doctors who treat such people, that is the animal bite victims, many of them are not aware about how to infiltrate rabies immunoglobulin in and around the wounds. And many are not aware that a rabies immunoglobulin requires to be infiltrated in and around the wound. Only vaccination is resorted to. But vaccines require a certain amount of time to generate antibodies in protective level. So giving rabies immunoglobulin immediately after the wound toilet is of paramount importance. It saves many human lives. So there is a lack in the knowledge. But over the years, I have been practicing for about 35 years in management of animal bites. I have seen that the awareness level amongst doctors and other centers has increased. But due to logistical or other issues, rabies immunoglobulin is not available everywhere, but almost all government centers where intradermal vaccination is used, their rabies immunoglobulin is available due to government's present plan.
Right. So I think awareness, for rabies immunoglobulin use, that is what is required, and I think it is very well addressed, sir. And I'm sure the clinicians who are listening to it would be definitely using it in future. Dr. Murugan, how does the vaccine supply for animal compare with human vaccine supply, and what challenges does the veterinary sector face? Sir, please unmute yourself.
Yes, thank you. At the outset, I would like to congratulate the Voice of Healthcare for taking up this summit and absolutely amazing. And talking about this, the vaccine availability for the veterinary sector, theoretically speaking, I can say that so there is a huge demand of vaccine, but in practice we are okay. Say for example, I mean we don't have the proper statistics, animal statistics in India. So roughly, if you take about the population of India, the dog population, both the owner dogs and stray dogs is together. If you take it as 9 crores or 90 million, we need about 6.3 crores or 63 million to cover 70% of the dogs. But that is not practically happening in India. So presently, the vaccinations which are going on is mainly on the government, the target of vaccinations or some donor vaccinations or the mission rabies vaccinations. So this is not going to create a big demand presently, and there is no in veterinary sector. There is no global supply and there is no global vaccination. This thing like what you have in a health sector. So except mission rabies, we are getting this um, uh, the vaccine from the global health sector, and we are using it for the entire mission rabies project in India. Other than that, normally the vaccines which are going, we are using is just the government sector. That is not too much now, and they are able to manage. And if they are not covering this 70%, this is going on. So when they go and make a plan for covering 70%, like what we have done in Goa. As you know, we started vaccinating the dogs in Goa with the 70% of vaccination year after year after year, and there is no rabies. So similar to that, if all the states are going to take up this 70% vaccination combined with education and surveillance, the Goa model, and then definitely there is will be a big demand. But of course, we will be able to make it. We are capable of producing the vaccinations. So that is something for the future. But presently, we don't have any issue of vaccinations against the demand. In the human sector, they have, plenty of vaccine because it is life saving and it is immediate. But a little neglect on the animal sector because anyway, it is going to be preventive and the results are going to be immediate, but it is going to take time. And on that basis, there is a neglect. But overall, if the entire country is going to take up 70% of vaccinations, definitely there is going to be a huge demand and they will be able to make it up.
Yes, I think that is a very good point, and if we just follow the Go model, what they have been doing in public health sector to prevent rabies, and by giving 70% vaccination to the dogs, we can prevent this deadly disease. I think this is what is required to be, implemented nationwide. Uh, Apoorva, what legal or regulatory mandates exist in India to ensure timely treatment for bite victims? How effectively are they enforced? And what gaps or reforms are needed to ensure equitable access to these vaccines?
Sure. Thank you for that question, ma'am. Before I begin, I just wanted to sort of start by clarifying just a common misconception about rabies originating only from street dogs. So that is sort of so the common perception is that only bites from street dogs might be leading to rabies, whereas when we look at disaggregated data, which is actually not readily available in most cases, we do see that a lot of dog bites also arise from uh, pet dogs. So that is what makes the role of responsible pet ownership equally important as much as animal birth control and stray dog population management, which is absolutely essential. So that has to happen. But coming to the legal framework surrounding dog bites, I wanted to talk about, of course, there is the Prevention and Control of Infectious Diseases Act. That's almost the only major statutory framework that is related to, which says that rabies is a scheduled disease. And then, of course, we have the national guidelines for rabies prophylaxis, which are the operational standards for the government facilities. In addition to this, we have the National Action Plan for Dog Mediated Rabies Elimination, which aims to eliminate rabies deaths in India by 2030. Now, this is a regulatory framework which looks at the One Health perspective and identifies rabies as a national priority and talks about coordination between human and animal health actions. So, as far as the enforcement is concerned, this has been alluded to that
There's some network issue. Miss Apoorva, can you hear me? Apoorva, yeah. Can you hear me? Can you hear me, Miss Apoorva? I think I'll go on to the next one. I'll get back to you. I'll get back to you. So, Dr. Hemant, how can a stronger One Health approach improve rabies prevention across both human and animal healthcare?
Thank you, man, for a nice question. Coordinated vaccination campaign that is in animal level. Mass dose vaccination is the most cost-effective way to eliminate rabies at its source. Human level, coordinated campaign ensure availability of post-exposure prophylaxis for humans at risk. One Health is in impact. Synchronizing these effects help reduce rabies transmission at both ends. Surveillance and data sharing. Animal health surveillance tracking rabid animal cases help identify hotspot, recording human exposure and cases improves response. Shared data leads to faster outbreak detection, together intervention, and more effective resource use. Community awareness and education is the most important. In animal sector, training for pet owner on responsible ownership and vaccinations. Human sector, public education on bite prevention, wound care, and when to seek post-exposure prophylaxis. One Health impact, unified messaging prevents duplication, confusion, and improve compliances. Stronger legislation and policy alignment, capacity building and training for veterinarians, healthcare workers, and community workers can be trained together to recognize the symptom, treat exposure, and educate communities. One Health impact across trained workforce is more flexible and responsive to outbreaks. Cost-effective resource allocation by sharing logistic, laboratories, and personnel. One Health reduce the financial burden of isolated program. Focuses investments on high-impact integrated intervention. Real-world example success in rabies animal in Latin America and parts of Asia have significantly reduces rabies through One Health strategy. coordinated dog vaccination campaign, pre or subsidized post-exposure prophylaxis for human, and joint public health messaging. A stronger One Health approach enhances rabies prevention by eliminating the virus at its animal source, protecting human health through early intervention, saving lives and resources through collaboration. This integrated strategy is essential for achieving the global goal of zero human death from dog-mediated rabies by 2030. Thank you.
So I think One Health approach is the only approach which is required, because if we just vaccinate the dogs and we have accessibility for post exposure prophylaxis, then this can be achieved. That is what we can get from the panel discussion so far. Dr. Murugan, what are the main barriers to implementing large scale dog vaccination programs in India?
Thank you very much for the question. Because in Goa we have done the mass vaccination in the state level, and if all the states or in the district level or the state level, if this mass vaccination can be taken up, that is the end of rabies. So we will be able to do it. It's done. So we will be able to cover 70%. But unfortunately, as you rightly said, there are barriers, and we are passing through that. To share with some of these things, there is no proper statistics for the dogs in the state level. Very difficult to get the proper statistics of the dogs. And you see, to share with me my experience when we went to Goa to start the rabies control project, the actual statistics available in the department was 30,000 dogs in the whole of state. So when we went to the field and when we did the survey and analyzed it, and it was 1.4 lakhs that time. So you can
Is that
imagine.
so?
So that is how it is. So
That's a huge.
completely, this is something which is, I mean, we need to do a proper statistics and a proper survey all over the country. It should be taken up by the government. So that is some priority. And if you take this, the method of vaccination presently, as you know, it's a catch and vaccinate and release method in the net catching system, as you know that is a very tough job. So even in our project also, 3 to 4 times we need to go to the same place again and again and again, based on the post-vaccination survey app recording, and which says how many percentage we have covered on the first day, then second day, then third day. Based on that, it is reported to the manager. Then he goes back again and again and again to achieve 70%. So that is a tough job. But luckily in Goa, we have developed another method of vaccinating, that is hand catching technology. So presently, you may not believe it, that we are doing around 40 to 50% of the dogs by hand catching. So I think I can say that the dogs are now very good with our catches. So they don't no more need the nets, and they are okay with the hand catching. So that is how it is. So this is a tough job of catching by net and handling them. So this is the biggest barrier. So we have to be very very strong and hardworking. Unfortunately, the manpower is another biggest barrier. See, even for our project, the Goans are not ready to work hard, and Goans are not ready to go at 5 o'clock in the morning. So we need to get the catches all over from Bihar or Jharkhand, as you know. So this is another barrier, getting this manpower. Too many number of people are required for this project. As you know, we have about 200 people on the road throughout our India projects to carry out this task and to cover this 70%. So this is another important thing. Then comes the finance. As you know, not like health sector, in veterinary sector, the animal husbandry department or some of the local bodies, they carry out this vaccination or sterilizations, and the funding is very limited, not like health sector. And what happens exactly is, with the limited funding, they carry out in certain areas. They don't do it, I mean like a Goa model, and they do it in certain areas to cover 30% or 40% or 20%. and then they leave it. That's all. There is no more funding. Then I mean, you can't see the result, as you know, unless you do it 70% again and again and again. And this is somehow it is going on, but if we don't see the result, ultimately we are not able to see the result. This is something which is the biggest barrier. So unless and otherwise we plan in a integrated fashion, time bound and area bound with the 70% coverage. So this is very difficult, which needs to be done. Possible, which needs to be done, and all these states needs to be trained on this one. And even sometimes, as I understand, this public sector, health sector is having sufficient funding, but unfortunately in the one health approach, they are not able to leverage this health sector funding to the veterinary sector so far. But this should happen. Maybe it will happen in the future. If this is balanced, then you will be able to win over doing this and eliminating this rabies at source through the dogs. That is something, the other one, which I would like to share with you. And also the monsoon, for example, if you go to Goa, about 6 months it is terrible rain. So with this monsoon, we have to run around and catch the dogs, but continue to do the same 70%. So that is the toughest job you can see. So that is another big barrier. And sometimes it's a difficult terrain, up and down, hill, down, sea. So all these things are there. So we have to win over it. Once they are trained, they are, our people are well trained, and they just do it. Any season, rain or whatever it is, they just carry out and all these things. Unfortunately, in this, as I told you, this bad terrains or forest areas or plain areas, in case if we can have oral rabies vaccine in India, that is going to really boost this. Along with this catching methods, if oral rabies is going to be used together, fantastic. So we'll be able to give a great coverage at a very less cost. So absolutely, it is amazing. So I'm looking forward to that day when we have this oral rabies vaccination to support the ongoing project that can enhance the coverage, and we'll be able to win over by 2030. I'm definitely sure about it. And awareness, as you know, this is 100% is required. This awareness can create a big what you call a big the human pressure, and this pressure, human pressure, can lead to convince the policymakers, and so that the policy can be taken up. The whole India will be able to prioritize this rabies elimination at source, and will be able to win over. So this is very much required. So awareness can lead to the world. Thank you so much.
Right. So well said, sir, that we have to eliminate rabies, so we have to eliminate the source. And for that, we require definitely finance, we require manpower, and we require oral rabies vaccine as well, because that will be a boon. So, Dr. Amlan, how do NGOs contribute to promoting collaboration between human and animal health sectors at grassroots level?
Actually, the NGOs, including the association where I belong, I am one of the founders, that's APCRI, it's an NGO only. We have been able to instill the knowledge of correct treatment of post-exposure prophylaxis in rabies in the case of humans, right up to the periphery, because we have got more than 1,000 members, and numerous awareness programs have been conducted by APCRI, and including this World Rabies Day observation. It is going on for the last 1 week. Programs arranged in schools, in communities. So multiple sectors of the society are getting aware about what is rabies, how to prevent rabies, and what are the way forward. So this is one way, so far as the human is concerned. And of course, if veterinarians are also part of the APCRI network, veterinarians are also full members of APCRI, and veterinary doctors are doing great work in different municipalities. They are going on with the mass dog vaccination program. But as Dr. Murugan said short while back, that is, unless we have 70% of the total dog population immunized in a given span of time, it is not going to decrease the incidence of rabies. So, a combination of all the factors, that is mass dog vaccination, dog population control, and awareness amongst the population at large, their NGOs have a great role. And both here, there is no divide between human and animal. In fact, I can see by having the experience of working for so many years that this change is taking place. Awareness has increased, and in the veterinary sector and also in the human sector, and as well as the lay public, they are also coming forward for treatment. And with the help of the mobile phone, that is internet is available to practically everyone, and with so many YouTube channels also publishing data, or so that is viewed by the users. So the knowledge base has increased, and it is in fact helping us. I think we will be able to achieve zero by 2030.
I think digital tools definitely help, and
Yes.
especially to create awareness, right? So, Ms. Apoorva, what role does public health law play in supporting awareness and bite prevention campaigns?
Thank you for that question, ma'am. So, the first thing that I want to say is that public health law does not exist in isolation. It exists at the intersection of environmental, animal, and human health. And in this context, it provides the authority, the structure, and the resources that we need for sustained bite prevention campaigns. So, for example, it has multiple dimensions like if you look at the National Rabies Control Program, right, it provides the legal backing for education and awareness campaigns related to rabies. When we look at the Animal Birth Control Rules of 2023, which have been formulated under the Prevention of Cruelty to Animals Act 1960, they create the legal framework for humane population management of street dogs. Similarly, we have the public health law strengthens the preventive infrastructure as far as rabies is concerned by requiring anti-rabies vaccination and registration. Laws reduce the reservoir of the disease, making awareness campaigns more effective. Further, we have laws like the Drugs and Cosmetics Act, which provide the quality standards that need to be maintained in manufacture of anti-rabies vaccines, etc. So, what public health law does it helps us standardize the medical response to rabies as a disease, and essentially laws require you to report rabies to health departments. It allows public health law enables targeted campaigns that can address specific challenges, right, and on the basis of the information that we gather during the implementation of the laws, resources can be allocated effectively for rabies elimination and bite prevention campaigns. Lastly, laws and regulations, public health law allows for interdepartmental coordination, which is absolutely essential if we have to eliminate rabies from India. And lastly, what public health law does is it tells us who is responsible, who can we hold accountable for whatever responsibilities are imposed for the prevention and control of rabies. So, public health law plays a very important role in helping us eliminate rabies from India. Thank you.
So, to allocate the resources, we need definitely the hotspots and the data sharing. That is what is there, right? And we have been talking about the responsibility of having a pet. So, what do you think, Dr. Murugan, that the veterinary doctors can do to educate those who have got pets?
Thank you very much. Actually, I can say it is not just veterinary doctors, it is education officers, school teachers, or NGOs. They all are responsible for educating and getting this responsible pet ownership. You can compare the responsible pet ownership in the Western countries, how they behave and how they go with the dogs and pet dogs. And people are thinking at Miss Apoorva very rightly pointed out, no, people think that only the stray dogs are causing rabies. That is not the case actually. So if you come to Goa project, in our records, when we are doing this vaccination and the positive cases, you may not believe it. 48% of the positive cases are owner dogs. You understand? So yeah, that's the way it is. 48% owner dogs and
Almost half.
52% almost half. Because owner dog means it is community dogs, and that one only community dogs about 20 to 25% are only the dogs which are completely at the home. You understand? The dogs which are completely maintained in houses, that is only about 25% of that owner dogs. The rest of them are semi-owned dogs and going to the street and coming back. You know that there are a lot of dog owners are the people who are who are taking care of these community dogs, and that is how it is. So most of them, they just get it. So this is how it is. So we have to equally treat these pet owners seriously, and all these pet owners needs to be responsible for it. This pet owner responsibilities combined with the compulsory sterilization, I'm sorry, compulsory dog registration. So this is going on. I'm able to appreciate. We are collaborating with the Mumbai City Corporation, for example, and they have done almost about. I understand they have done about 2 lakh registration so far, and so it's possible, and it is really good. And some of the cities are really good, and every place it should come, and people should go for compulsory dog registration and responsible pet ownership. This can be educated, and they have to change their attitude, and they have to take care of that. And once they take care of this, and if they understand the compulsory registration and pet ownership, these dogs are getting vaccinated. There is no rabies, number one, and other vaccinations are done, so there is no spread of other diseases, number two, and the dogs are going to be sterilized. There is no population is under control, and there is less population due to this, and by doing this sterilization, the dogs are going to be less aggressive, the dog bites are less, and when the dog bites are less, rabies is less, the human animal conflict is less, and so many pluses are there, and the public nuisance and all these things are reduced by this responsible pet ownership, taking care of the dog and avoiding the nuisance. So all these things are happening by this responsible pet owners. And usually what we teach them is they have to, these pet owners normally know what happens for the state of having a dog, or for the sake that the children are asking for a dog, they get it, and they never spend time with them. This is so unfortunate. So a pet owner is a person who is spending time with the pets and really taking care of the pets and enjoying the company of the pet. That is the way it is. This is not just like most of the places we go, the owner may not see the pet for quite a long time. Once in a while he see, and the pet is suffering, in fact. That is how it is. So this is something which is going to change that one, and the healthcare is going to improve on that. And the the important thing which I want to share is dog abandoning. So for the increased number of dogs presently in many of the places in India is the dog abandoning. What happens, as I told you, for the sake of getting the pet or for the influence of the children, they get a pet and get about 4 or 5 puppies one time, and 2 times in a year, you can imagine. So they cannot manage anything other than one dog, no space as well. So they dump the whole thing on the market. This is increasing the population like anything. So they are totally responsible for increasing the population. So unless and otherwise there is responsible pet ownership, this abandoning cannot be stopped. And once the abandoning is going on, see, for example, in Goa it is much more. In Goa we have 6 months season and 6 months non-season. During the season, a lot of tourists are there, and a lot of people are coming, and there are shack owners. They set up the restaurants closer to the beach. All through the beaches, thousands of shacks are built up, and they have pets during the season. The tourists who are coming are having pets during the season. Once the season is over from October to May, then monsoon starts. Once the monsoon starts, all the shacks are closed and the tourists are gone. Then they leave the dogs on the road. It is adding up again. In addition to the regular abandoning, this is a special abandoning. So this is a real pain. So that is really making a hell of a problem. And this can be avoided. All this can be avoided if we have the responsible pet ownership, and if we can train and teach them, if the responsible pet owners are good, and the number of animals are good, animals are less, no rabies. So that's the way it is. Then coming to the dog bite prevention, if there is no bite, no rabies. As you know, it is only by saliva. Luckily, this rabies I love the rabies because this is passing transmitted only through saliva, not like COVID, no, like air or water or touching this, that, nothing. So fortunately, it is only saliva. If there is no bite, no rabies. In that case, we have to teach them that we have to avoid the bite and we have to avoid the saliva, contact of the saliva. So you avoid the rabies. So this is something which is very important. Through the pet owners, we can train them, and the dogs are to be trained at the puppy age. You know, they have to train at the puppy age to have less aggressiveness. So once they train the pup, slowly, the dogs are trained to have less aggressive, so they don't bite more. You understand? So that is something as a pet owner they can avoid the dog bites. And the young children, they should not be left unattended. This is very important. I'm just talking with the practical knowledge of me in Goa and elsewhere. See, recently, just a month ago, one constantly there were some dog bite issues and hospitalization, and people were suffering. And one of the case was just a 5 years old girl, a migrant worker girl, and she was left at home because the worker cannot take her to the work site. So they left her at home. The child came out of the house and got bitten by the dog seriously, about 30 to 40 bites on her body. You can imagine. Luckily, she was saved. So this is how it is. So this is something they should not leave the children unattended. That is something which is a bit serious thing, and we have to teach the people not to, because most of the bites are provoked bites. So we have to teach the children not to disturb the dog while sleeping or while eating or while feeding the puppies. This always we do it in our and the lessons as well. So never run in front of the dog. This always we demonstrate as well. So when you run in front of the dog, normally the dog get excited and then they chase you and they bite you. So this is something which usually we teach them. And so we have to stand still when a dog is chasing you and coming and barking at you. We teach them to stand still, and most of the time we are successful. But all the time it doesn't work out. The formula doesn't work out all the time. Sometimes when you get a pack of dogs or some aggressive rabid dog or something, so definitely you are going to be bitten by the dog. So that time we teach them to protect your head and neck at least. As you know, so this virus, if you are bitten by the dog and the extremities, it takes a long time to reach your brain. So you have time to go to the hospital and take your injections. If you are bitten in the head and neck region, as you know, the virus quickly goes to the brain, and then you die. So for that reason, we teach them to protect your head and neck at least, and so that you are not able to get your the bite on the head and neck. Sometimes, most of the time in the children, for example, the dog is big and the child is small, so most of the time they fall down. So we teach them to curl and get your head buried into your thigh, so that you cover your head and neck and avoid the bite on the head, and you just allow the animal to bite elsewhere. So that is how we have to teach them. And the other thing is, we have to teach the children to understand the dogs. So whenever the children are able to understand the dogs, when they are able to differentiate between a normal dog and an aggressive dog, and definitely this is really going to help the baring teeth and the erect ears and stiff body and the barking and the raised fur. All these things indicate that the dog is really a angry dog, or sometimes a nervous dog, equally dangerous. Nervous dogs, a tucked tail and a shrunken body, that is also dangerous. So they also bite you due to fear. So if these things are taught to the children, they are really able to avoid the bite, and then they, they are able to stop the bite. So once you stop the bite, you stop rabies. So this is how it is. So these dog bite avoidance and bite avoidance and bite management is one of the biggest thing. This is a simple thing, of course. It is very very simple, but this is really going to help the people. So once you are bitten, whether by your fault or anybody else's fault, once you are bitten, the best thing is the water wash, which we have to promote it in a very big way, because by water wash, 80 to 70 to 80% of this virus can be removed on the spot. So we can just win over, and we can just manage a little bit of virus. If it is going to the brain, we'll be able to manage it by this vaccination or immunoglobulin. So in that way, this is the best way to avoid the dog bite and manage the bite. That's what I feel.
I think, right. I think you have shared very practical tips that we should not provoke the dogs, and if at all dog bites, we should at least protect head and neck, because that these are the critical areas where if bite occurs, we would be needing more care. So, Dr. Amlan, what have been the most effective NGO strategies for overcoming myths and misinformation?
Many of the NGOs, mainly so, I can single out one, that is Human People in Himachal Pradesh. Um, they have developed flip charts where their educators go to villages, and in villages, in the street corner, they show the flip charts that what type of dogs are rabid dogs, then following a bite by a dog, what to do, and how to go for vaccination and other things. Actually, vaccine is now free for all people in government centers where immunoglobulins and vaccines both are used. So these type of education at the grassroots level can be done by not one single NGO, but by collection of many NGOs working in local groups to educate people. But why I singled out the NGO in Himachal Pradesh is because I have seen firsthand in our WhatsApp group that they are doing the real thing which is needed. But ours is a very big country, and this similar type of approach needs to be implemented in other parts. And the role and government is doing whatever it can, but I think unless the people do it through their through NGOs, the education of level will not be so high. But over the years, again, comparing what it was in the 90s and what it is in the today, awareness has increased amongst the population by great leaps and bounds. At least in the human sector, treatment is available right up to the village PHC level. And in many cases, immunoglobulins are used in village PHCs also. But other awareness measures, like what Dr. Murugan said, that people should have responsible pet ownerships and how to deal with animals. This type of education is lacking amongst the public at large, and that has to be done by other NGOs as well. Not only Dr. Murugan's NGO, but others as well, because they cannot cover the whole country. Ours is almost a subcontinent, so it's so huge. So I think with that I conclude.
Right. And with that, I think I'll take quick comments from Dr. Hemant and Apoorva about the legal and advocacy perspective. So, first, Dr. Hemant, can you share from clinicians' perspective what legal challenges arise in rabies treatment and reporting? So, unmute yourself.
Key legal challenges in rabies treatment and reporting. First, mandatory reporting requirement challenge. Rabies is a notifiable disease in many countries, meaning clinicians must legally report suspected or confirmed cases. Is uncertainly certainly about what qualify as a reportable case. that is suspected exposure versus clinical diagnosis. Failure to report can lead to legal penalties and professional disciplinary action. Second, informed consent and post-exposure prophylaxis administration. Challenge. Rabies post-exposure prophylaxis must be administered promptly, but patient may refuse treatment. Issue. Legal concern arises if a patient refuses life-saving care, a minor guardian refuses post-exposure prophylaxis on their behalf. This clinician must balance patient autonomy with duty to prevent death from a universal fatal disease. Liabilities of is for misdiagnosis or delayed treatment. Challenge. Early rabies symptoms are non-specific, that is fever, malaise, leading to misdiagnosis. If a clinician fails to recognize an exposure risk or delayed post-exposure prophylaxis and the patient developed rabies, they could face medical malpractice claim. Coordination with veterinary and public health authority. Clinician must often work with public health department and animal control for case follow-up and bite investigations. Issue lack of clear protocol or poor communication can delay response, raising liability concerns. Risk legal implication if a failure to coordinate leads to public health consequences. Confidentially versus public health duty. Challenges protecting patient confidentially while fulfilling legal reporting duties. And issue is the sharing patient information with health or animal control authorities might conflict with the privacy law unless explicitly allowed. Risk HIPAA in the US or similar law in other regions must be carefully navigated. Documentation and legal proof. Rabies exposure case required meticulous documentation of site incidents, risk assessment, patient counseling, and post-exposure prophylaxis administration. Risk inadequate documentation can undermine legal defense if outcomes are poor. So, in summary, from a clinician viewpoint, legal challenges in rabies care and reporting include navigating mandatory reporting law, managing refusal of treatment and informed consent, avoiding malpractice liability from misdiagnosis or delayed care, ensuring interagency coordination, balance privacy laws with public health duties. Proper training, protocol, and legal awareness are essential to reduce risk and ensure safe, lawful rabies management. Thank you.
Rightly said, sir. These all things are required, and especially notifying the dog bites. That is what is very important. Taking consent is very important. So, Miss Apoorva, what specific legal reforms are needed to strengthen rabies prevention and ensure compliance with zero by 2030 goals?
Yes, thank you so much for that question, ma'am. So, I have a list of reforms that might be needed, but due to the paucity of time, I'll just mention one. I think one of the things that is stricter and more efficient and transparent enforcement of the animal birth control rules of 2023. Now, the thing is, they provide technical guidance on how ABC needs to be done, but we need additional legal frameworks which create obligations, legal obligations for municipalities to actually do this, and to ensure that municipalities even have the funds to ensure effective animal birth control measures. Now, as we have seen, that we have a national action plan for elimination of do not have state level plans for all such for all the states. So following the example of certain states, like Puducherry, like Meghalaya. Other states should also come up with their own state-specific rabies elimination plans. Apart from this, the standard operating procedure for the animal birth control was amended in 2023. So there are some inconsistencies between the standard operating procedure under the 2009 that was formulated, as well as and the ABC rules of 2023. So what is needed is, and now technology has advanced a lot. So there is a need to harmonize the two to ensure that animal birth control happens in an efficient and a transparent manner. And this is where we need public facing dashboards. It is always said that it is difficult to know the exact number of stray dogs because stray dogs is a moving population, and it's very hard to have a track of exactly how many stray dogs are maybe in a city at a particular point of time. But we can certainly keep track of the number of animals who have been sterilized, of the number of animals who have been vaccinated, and this data can be collated at the national level and at the state level to take actions in a targeted manner to identify which are the regions where there is excessive instances of rabies in a particular state. So which districts are there within each district, which area is more has the greater propensity of having such cases. So these are, so I think filling the data gaps is really important. Law is important, legal policy is important, but not all solutions lie in the law. The laws exist, the policies exist. What we really need is better enforcement. We need our municipalities to implement animal birth control programs seriously. We need them to not just sort of produce paper records of anti-rabies vaccinations, but to actually implement them in the field.
Right. So there is some network issue. So I think we have discussed the policy, we have discussed the clinicians aspect, we have discussed the human bite, we have discussed the prevention, and I think we should conclude the session. And in the end, I would like to invite Mr. Rajeev Arora to share reflections on the discussions held today. Because I feel that your perspective on the key takeaways from understanding India's rabies burden and challenges to charting the roadmap towards zero rabies by 2030 will be invaluable in guiding the collective action beyond this falling. So, Mr. Rajiv.
Sure. Thank you, Dr. Manisha. And good evening, everybody. And for my job is a bit easier to sum up or to reflect that the past 1 hour discussions. But I can imagine the kind of work that's going through, and especially each panelist is putting across. It's absolutely, I would say, stellar. So for me, it's been a completely a privilege and an honor to join you all for this National Rabies Summit for the year. And past 1 hour has been extremely, I would say, hearing to all of you have been very insightful from every distinguished faculty member from their own field, from clinicians to policy leaders and to veterinarians. And I think that collectively what I feel is it's all about how do we take it as a mission to accelerate this country's journey towards rabies elimination. So not take much of the time, but couple of minutes to sum up. Rabies, I think, the deadly but yet entirely preventable. One of the most feared infectious diseases in the world, and with almost 100% fatality once the symptoms appear. But the irony is, it's treatable, it's preventable, if the right treatment is given at the right time post exposure. And only way to stop or prevent rabies is through early, or I would say urgent and complete post-exposure prophylaxis, and which seems to all of us is the only way, effective way to prevent the disease. We all just heard how we all just how the country has seen a very I would say very significant jump in terms of the case or the incidence hike from almost 70% jump in last 2 years. And if I just remember what Dr. Simi mentioned, it's almost alarming in past 4 months of this year as well. So this search emphasizes a couple of urgent, I would say, actionables. One, increasing awareness, public awareness, to strengthening healthcare capacity or capabilities. By now, after hearing the past 1 hour discussion, it's not just one individual's, but I think communities must understand this rabies prevention is everyone's responsibility or the one health. And healthcare systems must ensure the instant access to vaccines or rabies immunoglobulin and trained healthcare professionals to administer those right drugs or in a timely, correctly and timely. To sum up, I would say fundamentally three things: the importance of community or public awareness through education, early action, and community level sensitization. That remains the first line of defense for rabies control. Second, pressing need to strengthen clinical protocols, the treatment guidelines, and that's primarily for how to effectively manage the rabies. And third, we must ensure that there's an access and affordability of vaccines and immunoglobulins if the need be arises. Equitable distribution related to on a reliable supply chain would be the key to achieve this universal coverage, especially in the rural and uncovered or underserved regions, if I have to be precise. Now, how does an industry play this role? Uh, Pharmaceutical industry, or to be very specific, BSV Mankind plays quite a pivotal role in supporting India's mission to eliminate rabies through prompt and complete PEP. As part of the broader healthcare ecosystem, we share the responsibility of building robust supply chains and distribution, ensuring timely access to anti-rabies vaccines, even rabies immunoglobulin. And for that, and that for us is not just a business, but it's a public health imperative or a responsibility. We share a common goal of 0 by 30 by eliminating human deaths from dog-mediated rabies by 2030 in our country. And with this, I think uh, you know, uh, I would once again reiterate to thank each of the panelists. I mean, trust me that it's I can see the kind of phenomenal work each one of you have undertaken and continue to do so in your expertise. And I look forward to working very closely alongside with each one of you in making this vision a reality. Thank you so much. Very nice of you all.
Thank you so much for all of you to joining in this session on rabies and giving us the insights. Thank you.
Thank you, Dr. Manisha, and thank you to the all esteemed faculty members.
Thank you.